दोस्तों, आप सभी का स्वागत है हमारी यूट्यूब चैनल पे। फ्रेंड्स, आज का दिन बहुत स्पेशल है और स्पेशल इसलिए है कि डॉक्टर सर्वानंद सर हमारे साथ है और सर के साथ हम रिसर्च किस तरीके से हमारी क्लिनिकल प्रैक्टिस में रिसर्च कर सकते हैं उसके बारे में जानेंगे। ये एक ऐसी अपॉर्चुनिटी है जो वंस इन अ लाइफ टाइम जैसी है, तो इट्स वर्थ इट। हम काफ़ी एंजॉय करने वाले हैं पूरे कोर्स को और सर बहुत स्पेशल है हमारे लिए। तो सर की उनके लिए, उनके इंट्रोडक्शन के लिए हमने एक स्पेशल वीडियो क्रिएट किया है। ये हम फर्स्ट टाइम कर रहे हैं हमारी चैनल पे। वी विश कि आप सबको पसंद आएगा। सो सर का इंट्रोडक्शन हम शुरू करते हैं।
Today, we have with us an eminent personality among the physiotherapy fraternity, Dr. Sarvanan sir. He is the Associate Professor and Principal in charge at the Sarvajanik College of Physiotherapy, Surat. His professional qualifications include Bachelor's in Physiotherapy from TN Dr. MGR Medical University, Master's in Sports Physiotherapy from Guru Nanak Dev University, and PhD from Sardar Patel University. He has a vast experience of more than 18 years in the academic field. He has got many achievements throughout his career. He is the resource person for many workshops, which includes taping and research methods in physiotherapy. He has various publications in peer-reviewed and indexed national as well as international journals of repute. He has participated and presented research papers in various international as well as national conferences. He is the editorial board member and reviewer in various international journals of repute. He was the scientific committee member and peer reviewer for the European Region WCPT Congress 2016, Asia Western Pacific Region WCPT Congress 2017, and Physiotherapy UK 2017. He is also certified in the SPSS course. He is a recognized postgraduate teacher and PhD guide in physiotherapy at Veer Narmad South Gujrat University. He is also the chairman Board of Studies Physiotherapy at VNSG. He is an elected member in Board of Sports and Students Welfare from Faculty of Medicine VNSG. He is the member of Institutional Ethics Committee at many colleges. He is the recipient of the prestigious C.P. Nair Oration Award at the 57th Annual Conference of Indian Association of Physiotherapists. He is the chairperson West Zone IAP Branch Coordination Committee. He has attended various seminars, CMEs, and workshops on various topics. He has also delivered keynote addresses at various state level and national level conferences.
तो दोस्तों, सर्वानंद सर की पहचान तो हम दे नहीं सकते। सर को वेलकम करते हैं और हम कोर्स शुरू करेंगे। वेलकम सर, वेलकम टू द शो।
Thank you so much, sir. I'm speechless after that kind gesture from your side. I was completely unexpected.
Yeah, it was a surprise for you.
So much.
Yeah,
thank you.
Thanks for joining, sir. It's a pleasure. और बहुत सारे viewers है, they are eagerly waiting for you. So let us start the course, sir.
Sure, sir. Sure, definitely. So good evening to all of you. So it's my pleasure and privilege to be part of this talking with Niraj sir, who is doing a quite good job for the past few days, utilizing the lockdown period to the maximum to serve for the community of physiotherapists. So I've been participating and watching his videos, his interaction with all the specialists in the field, taking up to different topics in the past 2 weeks. Thank you, sir, for inviting me on this platform and giving me this opportunity to interact with our community members.
It's a pleasure, sir.
It is. It is. I mean, truly speechless presently after seeing that introduction. Right. Um, it's my pleasure again, as I said, like, because I would like to thank technology for this, and it's a blessing in disguise having this pandemic, which has brought the entire fraternity together on a single platform. Technology was existing since beginning, but I think in education we are using it for the to the maximum presently. Hopefully, we don't misuse it like the way we do with most other technology. Um, I'm short of words to thank you for this, because when Niraj sir asked me about being a part of this session on this platform, I immediately said yes, and I've done a dozen webinars close to that, more than that, in fact, during this lockdown period. And all these topics, all the webinars were on research. So whenever people ask me, I used to convince them, saying that, like, there's one topic which I would like to talk about, which I would like to promote, sort of. I didn't expect Niraj sir to say immediately. He said yes. He didn't even think for a while. Immediately he said yes, and that's how we are here interacting with each other. Thank you so much, sir, for providing this platform. And of course, research is not an easy topic to sit and listen to. And through his, charisma, he has, pulled up lots of people. I think today we have lots of viewers from all around the world listening to this particular session.
Yes, sir.
So thanks for that. Thanks to technology once again for keeping us all together. So hope this session would be interesting to all. And as with any webinar, this is not a lecture session where we sit and listen and go. I expect more of interaction from all the members, so that, like, we all can learn together.
Yes, perfect, sir.
And I request all the participants, all the viewers who are viewing it, to subscribe to this channel, because we have lots of topics, interesting topics, which has happened already. And I think it's a very good way to learn more, and providing something free of cost like this, it's not an easy task. Like, so again, hats off to the entire team of Spinex, led by Dr. Niraj Bansali, sir. So keep up the good work, sir.
Thank you, sir. Yes. Sir, stage is yours. Please start, sir.
Thank you. Thank you, sir. So I hope the screen is visible now. So this is what we're going to discuss today: research in clinical practice, the need of research in clinical practice. Of course, at the end of the session, we'll be having a few tips on how to collaborate. What is the importance of collaboration in research, especially in clinical practice? There are a few reasons why this topic came into my mind. As I said initially, the dozen of webinars what has been done from my side on research. A few webinars were directed towards students to understand the basics of research, how to conduct a research from the student's perspective. We had a few webinars on the PG students or the PG guides, in what way they can encourage the students, in what way we can bring up some productive research. And a few research was also concentrated, a few webinar was also on the topic of getting research into practice, how the published research, which is available abundantly outside, can be critically appraised, and how that can be brought into practice. We had a session on that also. I was part of a session where reviewing research or reading an article, when that was done. One thing which was always in my mind was to interact with clinical practitioners, because I strongly believe personally that clinical practitioners are the ones who are capable of doing any sort of research work. Unfortunately, very few clinical practitioners are involved in research, and very few people are coming up with some good results in research. So this was always in my mind, and that's the reason when Niraj sir approached me for this, I immediately said, like, I would like to interact with the clinical therapist. So that's how we are in this platform presently. So before getting into the topic, I'd like to quote Phil Collins: "In learning, you will teach, and in teaching, you will learn." So this is not, I'm not here to teach everybody what I have learned. More than that, I'm here to learn with you all. So let's learn together. So why research in clinical practice? Again, I'd like to highlight, I'd like to repeat it, because clinical practitioners are the ones who can perform better research, because they are in close proximity with patients most of the time. And this clinical questions, the clinical questions, what we normally start with a research with, that is possible and that is mostly relatable or mostly logical only with clinical practitioners. But the problem is that, like as I said before, there are very few research papers or research process which has been initiated by clinical practitioners in India especially. So the reason why clinical practice should be involving research, because physiotherapy is an ever-expanding profession. We started off with the tag of massage therapist, and then we upgraded ourselves as exercise therapist and whatnot. And presently we are with the tag of movement scientist, the recent name what is being provided to physiotherapists. So physical therapy emphasizes the science of pathokinesiology and the application of therapeutic exercise for the prevention, evaluation, and treatment of disorders of human motion, as quoted rightly by Hislop, not recently, but way back in 1975. Cutting back to 2013, delving into the similarities between scientific exploration and physical therapist practice, we find that there are analogies and striking parallels at every step of the process. This is recent in 2013, quoted by Edely Feilford, and from there, the term movement scientist came into existence. So scientists are those people who are involved themselves in scientific methods and experimentation, and physiotherapy practice is related close to those scientific procedures and experimentation, and that is the reason why we should be calling ourselves as movement scientists. So since we are into scientific method, our physiotherapy practice should also be involving scientific method. Unfortunately, most of the time it is not the case, and that is where research plays a major role. And when you talk about physiotherapy practice, today evidence plays a major part. Most part of the world, even patients are aware of evidence-based practice, and they claim the treatment, whatever they take, they claim or they question the evidence behind that particular treatment procedure. So in physiotherapy, again, it is not left behind. But unfortunately, in India, again, the awareness is very less related to evidence-based practice among common public. So I would say, as a personal opinion, that even among physiotherapists, the practice of evidence-based practice is not that high. This is an era of evidence-based practice, and this EBP is the basic guideline. It provides basic guideline for a clinical practice. And this is where all the information what we gain is converted into knowledge. And evidence-based practice is the knowledge base. As rightly quoted over here, there is a strong link between the education, what we can see over here, between the education what we have got from our graduation or post-graduation, or in terms of the theoretical aspect, and the innovations what we try to make in our clinical practice, the new findings, that has to be incorporated along with good amount of high quality research, and that is definitely going to be utilized in clinical practice. This is what is a practical application. So how this can be reflected from the physiotherapist point of view during practice, during clinical practice, they have to question. Questioning is the basic of all these things. And what impact does this finding, this research finding, or a finding which is new to me, is going to be helpful in my clinical practice? That's the first question what they have to ask. Like, absolutely, after that, how am I going to incorporate this in my day-to-day practice? Is that going to be helpful? Will I be able to apply that in my practice? What are the difficulties in applying it in my practice? If it is applied, is it appropriately working for my patient population or for my culture? Can it be generalized to my population? If it is not generalized, what are the shortcomings, and how can that be modified, or how can that be filled? These are the questions that needs to be asked. And if you see, all these questions are purely based on research again. So research is the basic step, or can say the stepping milestone for evidence-based practice. It's always research-based evidence practice. Apart from that, as physiotherapists, we have the moral and professional obligation to practice which is research-based, because whatever we are practicing, that should be beneficial to patients. More than that, it should be less harmful, or there should not be any harm to the patients. When I say harm, it can be in terms of delay in recovery. Even that can be considered as a harmful procedure, delaying the process of recovery or the process of rehabilitation. So that again needs to be taken into consideration. And that is possible only when you have a clear idea of what research or advancement is happening in the profession. Similarly, it can be done only by moving away from all those technique-based practice, which is more commonly based on anecdotal testimonies or opinions from experts. And this is what happens most of the time, especially people who are not closely related to clinical practice, like most of the students. I can give examples based on academics because I'm actively involved in academics. So most of the students who are about to conduct a research in their internship or during the PG program, when they are not in close touch with clinical practice, the questions what they bring about for a research process or a research question what they start with, that does not have most of basic ideas. Even when they practice after completion of their graduation or post graduation, most of the techniques what they use, when you ask them on what basis you are using this technique, it is most of the time based on expert opinion. This is what my sir or my ma'am used to say. This is best because I think that is what they said. It's based on opinion. It's not based on evidence or based on any research finding. So probably this needs to be changed. So research is the only process by which this can change. And that does not mean, when I say outrightly, there are most anecdotal testimonies based treatment techniques what we are using. It's not only the techniques of treatment. It can be evaluative procedure or the diagnostic procedure what we use. Either it is outdated or it is completely not useful, not relevant to what we are trying to find out. And that does not mean, again, that most of the clinical practitioners do not use research for their practice. We do use research for our practice. There are people who know the basics of research, but probably the mistakes or there might be in a different direction. Let's see the logic of the frog. Thanks. I would like to thank and acknowledge Leslie and Mary for this beautiful example. We have a researcher. The researcher want to conduct some research. Say, since we are physiotherapists, we can say the research question is like, are impairments related to function, or will they lead to dysfunction or improved function? So the hypothesis that this researcher want to do is impairments are related to function. So he or she is testing it how? On a frog. So they want to find out whether impairment in a frog leads to an improved function or a dysfunction. So basically the researcher commands froggy jump, and the frog jumps, and the distance that is covered by the frog in jumping is measured. It was found to be, for example, 10 feet. That is the baseline data what we normally say in our research. Now the researcher thinks like, and how can I induce impairment here? So let me cut the four legs of the frog. The front legs will be removed now. So after removing the front legs, the researcher again says froggy jump, and now the frog again jumps without the four legs. Now the distance is measured and it is 5 feet. Voila. Operation success. Because that is what I want to know. Functional change. Now the researcher is happy. There is a functional change. I removed the four legs of the frog and there is a functional change. Now again he thinks like, what next can be done in this particular research? So he or she tries to find out what will happen if I remove both the hind legs too. So that again is removed. Now the frog is amputated. All the four legs are removed now. Now the researcher says froggy jump, and the frog stares at the researcher without jumping. Now, what is the logical conclusion based on this? There was a very good research procedure over here. There is a good progression of the research from the baseline to end. Every data was collected, what is required over here. The logical conclusion. This is an imaginary story, basically, an anecdote again. This is how most of us come to a conclusion. The logical conclusion is when all the four legs of the frogs are removed, the frogs become deaf. Exactly. So if you people thought that removal of all the four legs, the frogs become disabled, probably you are doing a proper basis of research. You are a research scientist probably. Most of the time research is done, but the conclusion of their interpretation, or what you can say it like, it's not based on reasonable conclusion. So we have to draw conclusions based on reasoning. And that is what is research about from the beginning till the end. So most of the time, this relates to, this example relates basically to the treatment procedures, what we are practicing most of the time, where we try to say that it works based on some illogical conclusions which does not have a scientific basis. There needs to be a scientific method of conducting research, at the same time, a scientific basis of reasoning the research at the end of the conclusion. So research is a process through which we can enhance the existing knowledge, and thus definitely it can change the information into knowledge. It is a cornerstone for effective decision making in clinical practice. When I say decision making, I can give the example of pain relief in physiotherapy, because we have, when we talk about physiotherapy modalities, almost each and every modality, whether it is a heating modality, whether it's a cold therapy or non-thermal therapy, whatever modality we use, almost all modalities, most important therapeutic effect is pain relief. So when you have, say, 10 modalities in your clinic and a patient comes with a specific problem, the pain, you choose one modality out of the 10. So when you have a proper reasoning of why you chose that based on scientific reasoning, that becomes a good research-based decision rather than saying it is my preference or it is just because my teacher said or my senior said. So research is helpful in effective decision making too. When we talk about the classification of research, this is the broad basic classification what I would like to introduce. It's not me, it has been introduced already, which is easy to understand even for a lay person. There are two basic aspects of research. One is the creative aspect where we try to get the idea. Second one is the action, that is the working aspect. So when I talk about creative aspect, this is where we get an idea. I'm practicing, a patient comes to me, I am evaluating the patient or I'm treating the patient. The treatment works in him and it is not working on a second patient who is similar to the same first patient. So probably this is where I get an idea, why is this treatment not working in one when it is working in the other? So probably that is the creative idea which can be taken forward into a research. So imagine a person who is not seeing a patient and he is conducting a research of some sort. The question would not be having a credible value over there. So the right person, the most advantage, the person being close to the patient, the person who is being close to the patient is the one who can conduct all these things, who can observe, who can find this disparity. So he is the one who can conduct a research in a proper way. That is the reason why clinical therapists are in a more advantageous position to conduct research, because they are in direct contact with patients and they're observing, diagnosing and treating them. I would say academicians again are in a position to conduct research. Of course, I don't want to put them down, but clinical therapists are having additional advantage of conducting research. That's one reason. And second aspect is the working aspect. So once you find out you get an idea, this is the idea, this is a question what I have in mind, what I want to find the answer about. So you make a plan of how to work out on that line. So you choose to collect information related to the particular question of your choice, and you decide from whom to collect that from, how to collect it. And based on your collection, this is what we call as data. And based on this collection of data, we try to find out the analysis and the results of the data. Do they support what we have questioned? Do they contradict to what we have thought of? Or there are some modifications which are required? And basically the second point, the information where to collect from, that is where the PICO format helps us. So from whom you are supposed to collect it, that's what P stands for, the population of choice. Your question, in which population you want to collect the data from. So that is the population. Intervention is the idea what you have in mind, the technique or the evaluation procedure or the diagnostic procedure which you want to test, which is new. That is what is the intervention. C stands for comparison. It can be a control group or you can compare it with some standard procedure which is already proven to be effective. And O is the outcome measure, on which particular what effect you are trying to find out. If you are using this particular intervention and the comparative procedure, what is the outcome? Is it pain? It can be functionality. It can be a subjective one. It can be objective one. It can be patient reported, or it can be a measured one. So this PICO format will be helping you in working out how to conduct this research and take it further. So there's one basic idea about the two aspects of research, the creative one where you plan, find out what exactly you want to do. And the second one is the action one, which is the working aspect, where you try to implement whatever questions you had in mind, whatever ideas you had in mind. Experimentation, that becomes a second aspect. Apart from this, we have another two classifications. And there are lots of classifications as such. You have qualitative research, quantitative research, classification based on the design or based on the methods. So there's another research classification that can be very easy to cope up with. That is the basic research and the applied research. When we say basic research, it has got less purpose. It is most of observation without a proper goal. You're just observing to find out the characteristics of your population of choice or your treatment choice or whatever. Whereas applied research is more of problem oriented, which is just opposite to the basic research. It is an upgradation of your basic research, and it is always directed towards a solution of an existing problem which you have found out in your clinical practice. That does not mean that applied research is more important and basic research does not have any significance. Mostly applied research is based on the results and outcome of basic research. Say, for example, an observational research which says that there is a prevalence of, say, musculoskeletal disorders in a specific population. Based on that, you can go for an applied research where you can find out solutions for those problems, musculoskeletal problems. So basic research is definitely helpful, and it can be utilized by people who are beginners basically. And we talk about the steps in the research process. This is one of the best procedure, what I would say. We have two stages here. One is the planning stage. As you can see, the planning stage is the time consuming stage as compared to the execution stage.
Excuse me, sir.
Yes, sir.
Yeah, sir. Viewers are suggesting that you go little slow.
Slowly. Okay. Yeah, fine.
Yeah.
Fine. Okay. Sorry for the speed, because this is my natural way of talking, even a normal communication. Apologize for that. I'll reduce my speed. So the steps in research process, as research is considered to be a systematic approach, we have to have a proper processing or steps which can be involved. Minimally, you can have a 5-step process, or you can have a 7-step process. Whatever the steps you involve in research, it has to be involving 2 stages. One is the planning stage, the other one is the execution stage. We talk about the planning stage. It starts with defining a research question, getting a research question. You have to clearly define your research question. Based on the research question, you have to state your hypothesis. Once these 2 things are done, that is the beginning of your planning stage, we have to find out whether the answers for these questions are already existing in the body of knowledge or not. So possibly what can be done is a review of literature would be helpful here. So once we have the question in mind, and once we have set the hypothesis in mind, we do the review of literature through different sources and different methods. So review of literature will help you understand or to get the answers for these questions what we have developed. So once the answers are available, research stops over there, because you have the answers beforehand. So you can use those answers for your practice. If the answers are not available or not existing, or if the answers are not satisfactory, probably we have to proceed with the further planning. And the further planning involves designing of the structure, and we need to identify the population. Again, I would like to recall the PICO format, that is identification of the population, what intervention you want to find out. You want to find the effectiveness of that intervention, with whom you want to compare that. Say, for example, you want to compare a new technique, let's say strength training technique. You want to compare that with the existing conventional physiotherapy program, or say we have lots of new techniques, tools available nowadays. I don't want to put a specific example and brand it, so I'm not giving an example. So your intervention of choice should be compared with existing standard technique. So you have to identify those things. You have to identify your samples. Population is again, it involves all the patients who are having the condition. So samples are those whom you select either randomly or non-randomly from among the population. It is not possible to involve all the people with a disorder or a disease in your study. So basically we choose samples either selectively or through random procedures. So samples, and including that, like we have to decide the sample size as well. How many number of people I'm supposed to include in my study. So that procedure is again supposed to be planned beforehand. Once that is handy, we have to go for designing. That is, which study design I'm going to use. Most of the research questions, most of the researchers basically fail to identify the study design based on their study research question. If you can see the arrow mark over here, so this is like 2 1/4. You have to come back to the research question again to modify the procedure. So you have gone through forward in this procedure till here. Before designing your study design, you have to again check your research question or the hypothesis, because study design is dependent on your research question. So based on that, again, you decide your study design. Once that is done, hypothesis testing, planning for that, which type of statistical test will you use? Will you go for a comparison? Will you go for an association? Will you go for a correlation? So based on that, you decide your statistical test as well. So till here, this is the planning stage. So the planning stage begins with the hypothesis testing, and it ends just before your data collection. So this is supposed to be the longest phase, because you plan everything beforehand and execution becomes very easy. You need not come back to your planning stage during the execution stage if it is done appropriately. Now from here, data collection starts. So we decide how to collect the data. We go and collect the data. You go for all your outcome measures, whether it is measurement of range of motion, say for example, or your muscle strength, whatever it is. You collect that and depending upon the duration and depending upon your protocol you're designing, you carry out your data. Based on that, you based on the collected data, you analyze it, and the results are obtained, and you draw conclusions based on the results, and then you try to interpret what those results mean to you and to your research question. And thus your research question is answered based on the analysis and the interpretation. All those things are related again back to the research question. So this is a cyclic process of research. So stages of research includes all these things, which is done meticulously. And one of the basic difference between doing a research, a scientific research, and a simple research is this. Say, for example, wherever we have options, wherever we have multiple options, you can say, we do a research. Because most of my students come and say that, sir, I'm not going to go for a PhD or a PG. So research is not useful for me. I can give a simple example. In clinical practice, if you're comparing your previous month's income to this month's income, say for example, before the pandemic, what was my income? How many patients did I get? And what is my patient's input presently? How many patients are coming to me presently? Here you're doing a basic research. So when you do the same thing in a systematic way with good amount of data collection and documentation, it becomes a proper scientific research. That is a basic difference. Every one of us are conducting research in our day-to-day life. The only thing is we're not doing it systematically. If done consciously and systematically with appropriate scientific characteristics, that becomes a scientific research. So this is basically the basic idea about what research is. And I think this discussion would have clearly identified why clinical practitioners should be involved in research. Because we are the ones who are treating patients on a regular basis. We are the ones who can identify the lacuna in the treatment procedures or in the evaluation procedures or the diagnostic tools, what we are using. Based on that, is there any change required? Is there any modifications required? Do these techniques really are required in our practice? All these questions are answered only when clinical practitioners can participate in scientific research. I would like to add up another example before getting into the next one. That is, again, clinical practitioners. When we talk about conducting research, we have a slide separately for the barriers of research as such. The question of choice is, I don't want to touch specifically on any treatment technique. Today, in our toolkit, we have lots of techniques which does not have an efficiency. We use most of the techniques in our practice which does not have any scientific basis. So how to identify that? So if you ask me, I can give an opinion based on, again, my preference. I can say this treatment technique is not, I don't like this. This is not effective in physiotherapy. Don't use it. But possibly if you question me, on what basis do you say that? We don't want to listen to your personal opinion. We don't want your preference. We want to know the evidence behind why this treatment technique is not effective. So once that questioning comes, research will automatically creep in. Once research comes, evidence is generated. Once evidence is generated, anybody using any technique can be having a solid scientific basis to justify why this is used in my treatment population. As I said before, patients in Western countries are aware of most of these things. Insurance companies, I'm not much aware of the system over there, but what I've heard, again, based on that, I'm just giving a point. Insurance companies pay over there. So if you are giving a treatment which is not evidence-based or which is not effective, which is not going to be beneficial for the patient, you're not going to be paid. There are advantages over here, basically. At the same time, ethical practice needs to be done. So possibly we can reduce the recovery period and the rehabilitation period, and we can reduce the financial burden on our patients, provided if we can give evidence-based and functional-based treatment options which are available already with us. Now, what are the barriers? So having said that, clinical therapists can practice research, of course. I think the previous slides would have consolidated the reason why clinical practitioners should be involved in research. Now, what are the barriers mostly what we come upon? saying that why I'm not practicing research, why I'm not using research in my practice, or why I'm not conducting research in my practice. Most importantly, the first one is time management. Of course, lack of time management. Every one of us have this excuse. Probably in clinical practice, the caseload, because in India we have a caseload which is much higher compared to any other country. So probably that is one reason, number of patients what we see on a day-to-day basis, that is too high. So probably we don't have a proper documentation. We don't have time for a proper documentation, which is very essential for conducting any research. Collecting a data on a timely basis and then documenting it, that probably is one reason, one barrier, which is very common, again, based on various previous studies, which has showed that lack of time is the first reason any researcher related to academics or industry or even clinical practitioners in any healthcare profession, that is one reason why we don't conduct a research. Second is lack of scientific training. Most of the clinical practitioners are not related to academics or updated to academics. That's one reason why people do not conduct research, especially when you want to practice evidence-based practice in physiotherapy or in any other field. Appraisal is very essential. Critical appraisal of an article which is available very free nowadays, and open access articles are available. But lack of expertise in critically appraising it, not knowing how to critically appraise it, or not knowing after appraising how to interpret it and use it or apply it in our practice, that is another reason. As I said before, documentation is one thing. When you want a secondary data from resources, the lack of accessibility to those resources again plays a barrier. So say, for example, if you want to get some data from, say, government resources or even from a private resource, probably we won't be having the accessibility to that. We won't be provided with those data. Probably that might be a hindrance to our evidence-based practice. That is again a barrier. I have included both the external and the internal factors over here. The last two are the most common internal factors what we can consider. One is lack of confidence. This can be interpreted in any way. It is multifactorial actually. Interest is only one thing. As I said that, like, how is research going to be beneficial to me? Like, I'm not interested in research, and interest is again related to the expertise, what we call, or to put in simple words, like, we normally do not practice what we fear. I'm afraid of my confidence in research, so that might be one reason why I'm not practicing research. So lack of interest. Above all these things, one of the most important barrier to most of the researchers, especially in physiotherapy, what I've come across is statistics. So people are afraid of numbers. Interpreting the numbers is a thing which immediately puts us to the reverse gear in conducting research. Of course, we can incorporate specialists of this particular area, statistics. We can incorporate statisticians in this. We have lots of physiotherapists who are doing statistics nowadays, and it's very simple. We are not going to get into the depth of numbers, and we're not going to create magic with numbers. We are just supposed to interpret what this number says. When you get a result in terms of numbers, how is that? What exactly does it mean? Does it say that, like, this treatment is better than the other one? Does it say both are same, don't waste your money? That is what we are supposed to basically understand. So basic knowledge about statistics is not that much difficult. It does not involve you calculating and doing mathematical calculations. We have lots of softwares available nowadays, which can help any physiotherapist to conduct the data analysis, and interpretation of data analysis will be made easier, definitely. So we need to come out of all these things. Identification of barriers is one of the important aspects, because when we want to bring solutions, we need to identify the problems. So we are lucky enough to have the major barriers which are known to us. So most of the barriers are internal, as per my knowledge again, and as per research, it is internal. So if we overcome these internal barriers, automatically the other things will fall in line. Apart from these things, we can add up the library resources, because clinical practitioners does not have access to libraries where they can go and refer certain things. But again, I think most of the materials are available online nowadays. Technology has improved to that extent that most of the library content is also made available online. There are some areas where we cannot be getting the accessibility, but still it's fine. With the available resources, these barriers can be broken, and definitely we can progress further in research if we can address these barriers. The most important thing, as I said before, is the internal factors. We have to build up confidence. We have to get motivated, and we have to increase our interest in facing this thing. Because if not today, tomorrow we have to practice evidence-based practice, because that is what is going to push our profession forward. For the progress of the profession, you can say I'm not that old to say that, like, for the next generation, probably for our generation, it is very essential. We will be forced to practice evidence-based practice. We have to use only those tools which are going to be helpful for the patient and for the profession. So research is inevitable. The positive thing is that there are lots of studies, very few to name in India, and as per my review of literature, there is no study in India which has been which have tried to identify the perception and attitude among clinical practitioners, physiotherapy practicing clinical therapists. But in other profession, and mostly in students as well, most of the studies have concluded that they have very good positive attitude towards research and evidence-based practice. And most of them accepted that, like, it is very essential and it plays an integral role in practice. So these are the positive things. We are accepting it. We have a good positive perception towards research and evidence-based practice. We also believe that it helps us in clinical decision making. And the decisions what we make based on research is very strong. All these things are available on, based on research. On the flip side, most of these studies identify that the clinical practitioners in other profession as well, not only in physiotherapy, believe strongly that research is something to be done only by the academics. And in some of the panel discussions, we had a panel discussion recently that was again a webinar, panel discussion on whether research is supposed to be incorporated, forced basically, to be done in UG or not. Like, it was between some PG guides from different parts of the country. Again, in the panel discussion, it was said that only, like, academicians should be compulsorily doing research. Again, UGC has made it compulsory. Research publications are essential for promotion, for upgradation of your designation. That's fine. But what about clinicians who are always treating patients? So it is not only academicians who are supposed to be mandatorily following research work. Clinicians also, as we have discussed in the initial stages of this presentation, clinicians play a major role in patient handling. So they are supposed to be upgrading themselves in research. And again, I'm repeating again and again, this does not mean that clinical therapists are not using research or does not know about research. I've got lots of examples where clinical therapists are excelling very well in research, who are using evidence-based practice to the core in their clinical practice. And that is appreciable. The effort what I'm trying to put here, or the conclusion what I'm trying to make here, is basically we need to have more clinical therapists participating in research. And identifying the barriers, we have done that. It is there. We have to accept it. And probably overcoming the barrier is the next step towards this, like, and definitely that can be done. And this is where the last aspect of today's interaction, that is collaboration, comes into play. So what is collaboration? Collaboration can be anything. It can be networking, normally the way we do. It can be a clinician or an academician partnership, or most of the time it is at the end process of your research, that is publication. When it comes to publication, it is co-authorship. And I'm not going to touch into the part of the ethical aspects of authorship and everything, because that is entirely a different area. So any of these things can relate to collaboration. Collaboration can mean anything. But why to collaborate? That is what is supposed to be understood. So as we identified the barriers, academicians by default, they have to upgrade themselves in research. So what we academicians normally, most of us normally do is, theoretically we are strong with the research aspects. When it comes to conducting research, the resources what we have, the patient population what we want. I'm not talking about overall in general, because say for example, I come from a background where we have our own hospital. So when it comes to patients, number of patients, we get good number of patients from our hospitals. So conducting a research in such a area becomes very easy. But imagine an academic background where there are no hospital attachments or less hospital attachments, or only OPD postings are available. So we require more amount of patients for conducting research. So probably there again research comes out, but more in a theoretical conceptual way, not in terms of a real scientific research. So probably collaboration with a clinical setup. A clinician actively participating in an academic research, that becomes more powerful. So we can recruit more number of patients, more number of subjects, more number of samples in quite a short period of time. And definitely, I mean, probably like, I'm sorry if I'm generalizing it, like, I mean, most of the research which is done in the wrong way, unethical way, manipulation of the number of patients conducted being involved in the research, all those things will automatically come down. So that is one important aspect of why collaboration should be done. We can get diversified perspectives from different people. Like clinician, when they practice on day-to-day basis, like they can come up with different ideas. So an academician who is having a stronger theoretical concept, when they combine together and when they conduct a research, probably that collaboration would come up with the different perspectives. We'll be getting more ideas. And this will provide definitely motivation to clinicians also. Like, so wherever they have a technical difficulty, the academicians can be of help. And wherever they have the scientific difficulties, the clinicians might be of help. So when you collaborate in such a way, like definitely that is going to come up with a diverse set of skills. A common goal can be achieved basically, evidence-based practice. Improving the standard of the evidence in physiotherapy. That can improve with this particular collaboration. And most importantly, collaboration can be used as a very good tool for learning, for growing, and for excelling, for self and for the profession. So these are some of the solid reasons why a collaboration should be done. We have collaborated, of course, two of my research, it is ongoing still. We have collaborated with therapists from other cities. One of the research is done by some of the PG students in other colleges. So they help us. So we involve them as we collaborate with them. So that collaboration helps us to increase the number of subjects in our study. That is one way. And the other way, from that particular point of view, the student, PG student who is involved in this particular study, they are trained to do this. So they get training. They get to learn how to perform a data collection procedure. They get to learn, they do mistakes, they learn from that. So that is how we grow. And what are the requirements for a successful collaboration? The first and foremost thing is patience. The most important thing is because we have to have a common goal, and research is something which is time consuming. Most of the research which is meticulously planned and organizedly done, systematically done, requires lots of time. So both the collaborators, whether it is, I mean, party one and party two, both are supposed to be patient enough to do that. And they should be coming under a common platform with defined responsibilities, understanding each one's responsibility and boundaries, because this collaboration is going to come up with agreed deliverables. The output, what we get from this collaboration, is definitely valuable. So we have to understand our own responsibilities when you come up with the collaboration. So if that is very clear, definitely the output is going to be good. And a highly responsible attitude is required, because research is systematic. So one of the research what we conducted way back in 2013, if I'm right, we had the maximum number. That was the research which I did with more number of people, and believe me, it did not go well. The output was the research ended well. We had a good analysis interpretation, and we published it, no doubt about that. But the entire process was not pleasant. Most of the people did not take the responsibilities. There was no attitude of doing a research in a sincere way. We have to cut short the research, do it faster. We had lots of issues. So we have to have like-minded people working towards a common goal. So that is what is required. All these are supposed to be planned well before collaborating. And this collaboration is definitely going to benefit both the parties. So having said that, like, where to begin with? Where should I start? So probably viewers, among the viewers, I think like today we have more than 500 people watching this session. So among that, like some 10% of population, even if they think of, I am interested, where should I start with? So we have to start with basic understanding of research. We have to question ourselves, what is my level of understanding research? Everybody is learning research. Nobody is an expert. Like, it is a learning process. There are lots of things what we will learn through the process. So what is my level? Where do I stand? And I can improve that. How to improve that? You can start with self-reading or self-learning. Definitely we have lots of resources available nowadays. Every resource is useful for us. That can be done. If it is not possible, you don't have time for all those things, get into tutor learning. Lots of people If they are interested to collaborate, definitely will be interested to motivate you, to make you understand what needs to be done, will be ready to learn along with you. So tutor learning is again possible. And one of the thing what I would suggest with to begin with is clinical therapists can participate, collaborate with some of the institutions and participate with journal club. Even if institutions are not allowing them to participate, like they can initiate a journal club. Possibly, if I'm right, the place where I am from, Surat, we have certain clinical therapists who have formed certain groups, and they are into critical appraisal. At least once in a while, they are doing it. That should be done on a regular basis. So EBP related activities, evidence-based practice related activities or programs which is happening around the globe or in the city, we need to participate in that. Like a journal club is one good way by which we can share knowledge, where we can understand what is being updated, what is happening around in our profession, all those things. Conferences again are a very good platform. Again, there's one area where most of the clinical therapists think that conferences are only for academicians. Only academicians can go and learn or do whatever they want. Clinical therapists are, the participation is very less as compared to academicians. And the one reason is again the same, like because when you go to a conference, the main objective of us is to go and present a paper or to listen to a paper. So research is the main idea behind conferences. I mean, at least that is what is my understanding. So probably that is one reason why, since we do not indulge much in research activities, possibly that is the reason why we do not attend most of the conferences. And the final one is seminars or webinars, as it is put rightly. Like if it is a seminar happening, CME happening, CPE happening, definitely we can participate in that and relate to research. We can come up with some ideas or can improve our understanding. Unfortunately, though, there are very few topics, few seminars or webinars happening on research basis, because during this entire lockdown period, most of the technique-based programs were predominantly happening, and very few research-based programs are happening. So again, if therapists who are good in research, who are good in evidence-based practice, academicians who are good in learning, and in turn teaching and motivating students and clinical therapists, I request they can come forward and talk more on these topics. They can involve more clinical therapists in this particular way. That way we can collaborate and improve the understanding of research, and that's where we can begin with. So these are the basic, you can say, the tips and tricks from where you can start. So this is the beginning. Most importantly, after all this understanding, if we do not think critically, if we do not question, if we blindly follow whatever is being said or done, not based on scientific method, nothing can change. So we need to start thinking critically. So critical thinking is definitely why, what, how, this question. These are the basic things what we're supposed to ask behind every procedure what we're doing, whether it is diagnostic or therapeutic. So those things, these are the essentialities where we can start with. As I said, research process starts with questioning. Evidence-based practice starts with questioning. Progression or upliftment of any profession starts with questioning. So questioning is the basic thing. So in a nutshell, I can say that research in physiotherapy is very essential, and I have provided lots of factors why it is supposed to be essential, especially in clinical practice. It is essential for legitimacy of the profession or for the upliftment of the profession. It is very important to have an independent status for us. So when you say my treatment is effective, I am able to handle a patient, because presently we are no more in the management phase. Previously, we used to manage our patients. Today, we treat our patients. We claim lots of things. When we provide a scientific basis for all those things, definitely our profession will be respected than what it is presently. That definitely will be putting up autonomous status to our profession. It is the foundation for professional practice, as discussed earlier also. This needs to be conducted. The research needs to be conducted in collaboration with education, industry, and the clinical setup. That would definitely result in highest level of evidences, which is lacking in most of the areas. You talk about any specialization, most of the treatment techniques are lacking evidence. Probably we need to conduct high quality research so that we can find out whether these treatment techniques or diagnostic procedures should be given a place in our practice, or should it be used in moderation, or should it be removed. We can come to a conclusion based on this. So my take-home message basically is that research is not difficult. The fear of research is what is making us delay understanding research. So lack of knowledge is not the problem. The illusion of knowledge is always the problem. So once we identify that knowledge is missing, we can always try to gain it. But when we do not accept it, we have a difficulty. So probably my request is, I am into the learning process day to day. When I discuss these things with my colleagues wherever, with my passed out students who are mostly practicing in Surat, clinical practitioners, they are the clinical practitioners. They are the heroes of today, who are in touch with patients on a daily basis. When they discuss with me about a treatment protocol, of a treatment plan, of a workshop to attend, of a seminar to attend, I am discussing all these things with them. I am learning with them. Today's session, at the end of the session, when questions are being asked, based on those questions, depending on those questions, I'll be learning a lot of things. So most of the physiotherapists, I request most of you should come out, start learning, start applying, and as it is mentioned very clearly here, the legitimacy of the profession depends on us, the academicians and the clinicians. Thank you. Thank you very much. Niraj sir, thanks for your time.
Thank you very much, sir. Thanks a lot. It was wonderful. And you rightly said that illusion of the knowledge is dangerous, and it's really a dangerous thing, sir. It's wonderful, sir. Sir, before we proceed for the question and answer session, I would like to announce three things, sir. May I, sir?
Yes, sir. Sure, sir.
Yeah. Friends, those who have done registration on the Google form, please write your name in the chat box and a thumbs up sign, so we can understand that you are participating, and we can release the participation certificate to you only. Second is about how you can do research in your clinical practice. We are going to have master class. This master class is of 6 webinars. 8 p.m. to 9:30 p.m. Will be the timings. That will be next week, 3 consecutive days, and another week there will be more 3 webinars. So total 6 webinars are there for the master class in research in clinical practice, which will be conducted by Dr. Sarvanan sir, and there are limited seats. Our purpose is that people who really wants to do research in their clinical practice and come forward, and they want to publish their research internationally and nationally, they learn the research methodology in real sense. And the investment is only 2,000 rupees for all 6 webinars. So those who are interested, they can WhatsApp me, they can mail me, so we can line up the things. Thank you very much. And about the our Sunday program, it's on spinal cord injuries by Dr. Dwanit Shah sir. As we all know, Dr. Dwanit Shah sir is a principal at the Government Physiotherapy College, New Civil Hospital, Surat. He is going to have a webinar on spinal cord injuries. It is absolutely free webinar. So those who are interested, we are going to circulate the forms as well. You can fill the forms to get to be eligible for the digital certificate. So these 3 announcements are done. Thank you very much, sir. Sir, shall we go for the question and answer session?
Sure, sir. Yes.
So first question is from the Krishna Mistri. She is asking that if there is no previous research carried out on similar kind of question which we have selected, how should we proceed with it?
If there is a previous research already carried out, why would you go for a research? Krishna, we do research in 2 ways. One is in an area where it has not been explored, or an area where it has been explored but the answers are not satisfactory, or you find out that there is discrepancy in the results or interpretation. So probably that is how we conduct a research. So if there is no previous research carried out in that area, it is positive, good go with it.
Fantastic. So Physio Plus is asking that, sir, can you brief about the plagiarism in research? Can you suggest a few tricks to reduce plagiarism in research? Thank you, sir.
Plagiarism is like a weed in research. Basically, again, it is internal and external. Internal is, I'll talk about internal first. Again, you can have a separate session on plagiarism and the types of plagiarism, what is called as plagiarism and everything. Internal is that, like, first we need to understand, identify that this is what I'm doing is unethical. It is a plagiarism. Plagiarism means to kidnap. That is the meaning of plagiarism actually. So it can be from anything. It can be, say, for example, you're not reporting data which has been collected just because it is not supporting your hypothesis. That is plagiarism. If you're not, if you're selecting your samples to in which group you want to go, you're manipulating your samples who are selected in a specific group. That can be plagiarism. Knowingly doing a mistake is what is plagiarism. And plagiarism starts from your planning stage. It goes till your publication. One of the commonest thing which is happening nowadays is copy pasting. Even that is plagiarism. Imagine you have a study saying that, like, you have taken 100 patients with low back pain, and you have taken only 2 patients, and you replicated the data, you manipulated the data, you took the help of a statistician. You did not collect data of 100 people. You have just manipulated it. Today it's possible. With some amount of mathematical knowledge and statistical knowledge, you can do all these things. When you do it knowingly, that becomes plagiarism. And all these examples what I gave, if you know beforehand it is not to be done and you do it, we should avoid that. That's the first trick. And if you're talking about publication plagiarism, there again, one is draft related. That is whatever I draft, the content of my article, that can be having some similarities with previous articles, or I might have copy pasted and I have forgot, I might have not have acknowledged it, cited it. So probably citing a concept in your draft, that is a way to reduce plagiarism. That does not mean that I can put every copy paste everything and then cite everything, which means that does not have any originality, does not have any of your content. So basically that is supposed to be taken into consideration. One of the most common plagiarism happening is the plagiarism of authorship, which is very common among every profession and which is highly prevalent in our profession as well. So authorship in the sense, like, say somebody is doing a research and he or she is known to me. So I request he or she, please put my name. I'm not interested in participating in the research, but just I want the name. So they add my name and publish it. So I have a publication in my name. That is plagiarism. So most of the time it is known plagiarism what is happening. If it happens unknown, these are the methods. These are the things, the way I said, like the barriers. These are the things what are called as plagiarism. Understand that. And if it is identified priorly, try to avoid it.
So wonderful, sir. Sir, one more question similar to this is from Falak. He is asking that, sir, please arrange a session on critical appraisal of already available research as well.
Thank you, Falak, for the question. I think he wants a revision of the critical appraisal. Dr. Falak Kanabar is my student. He has done PG under me. Critical appraisal, we had a webinar, if I'm right, last week on searching research. That was the basics of how to conduct a search, and critical appraisal, definitely it can be done. Probably the web series what we are planning presently, one of the session we'll be having critical appraisal exclusively, and that will be hands-on, because after teaching how to critically appraise an article, you'll be given a homework to conduct a critical appraisal and bring it back. So we'll be doing it. That is an integral part of understanding good article, published article, and which article is not relevant to our area, or which is probably plagiarized article, or manipulated article. Critical appraisal is very essential.
So Tarpan sir is also viewing our show. Sir, he is asking, sir, can you give some idea about the open access resources?
Definitely, sir. We have lots of open access resources. Again, we can classify that into predatory and genuine. And We have lots of things. Probably presently UGC CARE has come up with some resources where we can go for open access publication. And the CARE list is yet to be finalized, and it does not have medical journals. So what they have suggested presently is journals which are indexed in Web of Science and Scopus. So again, presently it is impossible for me to put the list of the open access resources. That's a positive thing, is we have lots of open access resources nowadays available. Only thing is we have to be choosy with going for it, avoiding the predatory ones.
So Krishna Mistry is asking that the statistic we perform and the answer we get, how are we supposed to know that the answer we have got is correct and our interpretation is correct if there is no previous research conducted?
I think the question is a bit of twisted here. I, according to my understanding, if there is no previous research conducted, you are going to interpret only your research. Probably you want to compare it with previous researches which has been already out. So if there is no research, you'll be interpreting only your results. It's not like every time you have to compare your research with other research if it is not related. And again, based on the statistical test, we are not going to again go for the previous study, comparing our statistical analysis and then finding out whether the result what I have got is correct or not. It is only your results which is going to say whether the output, what you have achieved, that is good or not good. Say, for example, if you want an example, the p-value is what is being highlighted everywhere, which is basically wrong. We cannot conclude everything based on p-value, right? If you're talking about the effect size, so I have got a result, p-value is less than 0.05. My result says that the intervention therapy, what I have tried to find out, is more effective. I mean, it is better than the other one. Now we have to find out the effect size, which can give an idea about how big the effect is. It is statistically significant. Is it clinically significant? The change what we have obtained, is that good enough to apply it in our practice? So that is based on our results only, your research and that results, that is what is going to be helpful in applying, except for some comparisons where you want to correlate that with or compare that with the previous studies. Not necessarily every time.
So Dr. Divyesh Pancholi is asking that which are the nice and friendly software of statistics analysis except SPSS?
It depends on, I mean, again, which one R software is there. We have a software called as R, Stata is there, Prism is there. And out of all these things, SPSS is more advantageous. The reason behind is user-friendly, that is one thing. Second thing is that like it is almost, it has all the parameters which can be done in your research, starting from, the basic calculation of mean and starting from your standard deviation, everything, your ANOVA, t-test, non-parametric test, correlation test, repeated measures, all these things are packed in one. The only disadvantage is it is paid. It is very costly. Even Excel is very good form of, platform to do all your analysis. Microsoft Excel is of good help. Even that can be used.
So many people are suggesting that you give more explanation about the research and how it is to be done. Sir, I think that is covered in masterclass. Sir, you can explain better.
Because in 1 hour, definitely, I believe strongly, like we cannot make everybody an expert. Basic understanding, the main aim of objective of this webinar is to just create interest in every one of you. It is not to make you an expert. Definitely, it is not to teach research. That's why I initially said like, I am learning with you. So if you want to be an expert in research, definitely it takes time. 1 hour is not sufficient. I believe the same thing is applicable for any technique which is being taught on a webinar. Any technique. A PNF, if I'm giving hands-on PNF technique on a webinar, that won't make you an expert in PNF. You have to practice it. Same with research also. So probably the masterclass will be going in depth about all these aspects. This is, if you see that, more of theoretical, it is more of philosophical, my experiences, what I had, what I've been experiencing related to research with students, with my colleagues. All those were the learning experiences, what I've been sharing with you. Whereas in masterclass, this is not the way. Masterclass would be very specific to how to conduct a research. If you want to do a research, where to start from, how to start from, how to critically think, all these things will be covered there.
Fantastic. So Dr. Divyesh Pancholi is having another question. In clinical research, which kind of study is useful, like case study or RCT or any other?
Any type of study can be used in clinical research. The study design is not dependent upon whether you conduct a research in an academic level or in a clinical level. It is dependent purely on your research question. The research design is based on your research question. So case study, say for example, is normally done where the patient population is very special, where you don't get number of patients, or in a technique or in a tool which you are using, which is very unique. So it is normally done in unique situations. That is what is a case study basically. So when you want to conduct a case study in multiple times, you go for a case series. When you have a large population where you say, for example, you don't know the prevalence of a specific condition and it's a large population, your research objective, the research question is to find out how many percentage of people are affected because of this particular disease. Say, for example, Corona, COVID-19, how many people are affected? So probably I'll be going for a prevalence study over here, which is a cross-sectional study design. So if you want to find out the effectiveness of a treatment in COVID-19, and I want to compare that with an already existing treatment option, probably I'll be going for RCT, an experimental study design. So it depends on your research question, not on the research setup.
Sir, Diditi Desai, she's asking that can you explain little bit on whistleblowing in research?
Controversial. That is the word what I would say, because definitely without examples we cannot get into this area. The moment I give examples, I will become a controversial figure definitely. I don't know how to explain without examples. That is the problem. Diditi, definitely we will discuss on this personally, on a personal platform, not on this private platform.
So Falak is asking that how to check for draft related to plagiarism.
We have lots of softwares available, free softwares, web-based softwares, and paid softwares. You have to just copy paste your draft in that and you can check for plagiarism. It is just a plug and play sort of thing. Like you can just click and within few minutes you can get the percentage of plagiarism of your article, of your draft. Like, so if it is cited, probably that does not mention it. If it is not cited, it definitely picks it up. So Turnitin is one software which is a paid software which is used mostly by most of the university libraries to find out the plagiarism of the PG researches or the PhD research thesis.
Yeah, so Dhruvi Parmar is having similar kind of question that how do we differentiate, how do we consider if the data is standard and not plagiarism?
Difficult. It's very difficult unless and until it is like the person who commits a crime. We normally say that we watch it in movies, isn't it? Like jitna bhi acha crime kiya hai, kuch na kuch surag choda hoga. That sort of thing. Like it is very difficult to identify the plagiarism in data. Probably can assume when you critically appraise an article, probably from the what you can say, the analysis what they have done. It is possible sometimes to identify the data which is manipulated. I won't say plagiarized over there. Like I would say manipulated. That is possible to identify. It's very difficult if it is. I mean, nowadays, as I said before, like there are people who are very good with this manipulation of data. It's very difficult to identify. Even in peer review process, when we conduct peer review process of very good journals, like say in a month or so, like I peer review around 3 to 4 articles in a month. Out of that, in a year, say for example, I get to know the manipulation of data in some 1 or 2 articles. And that too, there is no substantiating evidence to say that like it has been manipulated. It's difficult to prove again.
So Dr. Aarti Vatiani, she is asking that amazing session, sir. How to select the journal or magazines for publication of our research articles?
Thank you for the comment, Aarti. And regarding the question, UGC has been doing that job for the past few years, and even presently in India for publications which needs to be, sort of authorized for career advancement in academics. Like they say that only articles which are published in the care list, UGC, has it is coming out. Presently, we don't have the list of journals for medical profession, that is medical and paramedical. We don't have it. But presently, it is always better to go for Scopus Index journals and Web of Science journals, which are indexed in this, because they normally scrutinize and avoid predatory journals to be indexed. If you go for most of the paid journals which are promising that like we will publish it in one day, those journals are normally predatory. We should be avoiding, and it does not involve a peer review process. And there are a few journals which do conduct peer review, and the only corrections what they give is decrease your number of words or change the color of your table and that sort of things. So it takes expertise to some extent to understand which journals are genuine and which are not genuine. You can check in the web.
So Dr. Riyasha is asking how to check the articles that are used for literature review are standardized and not manipulated.
Critical appraisal again will help you. There are three components which are supposed to identify in an article. One is the method that has been used. What method has been used? Is that standardized? The tools what they have used, is that standardized? What statistical test have they used? Have they used the appropriate statistical test relevant to their research question and the study design? And the third one is generalizability. Have they concluded in their discussion? Have they discussed their research question based discussions, or they have given all their opinions after conducting the research also? Critical appraisal tries to cover all these three major areas. So when you critically appraise and find out that this particular article has done all these things properly, no research is 100% perfect. There is no research which can be called as 100% perfect. What we're trying to find out is which one is close to perfection. So if these three areas are, genuinely identified and it is good, definitely that can be considered as a article which can be taken for a literature review or as your mother articles. I don't believe in the word mother article, but still, if that is what is being highlighted here, we can take it for that.
Sir, Dr. Riddhi Mistry is asking, sir, can you please give some easy idea about how we can find out new recent advances? Which one is useful for patients' treatment?
Again, there is no easy idea. The easiest one is critically appraising available evidence, available research articles, and then identifying which one is a good research, which research has been done in a genuine way, and following those things. Apart from that, like easy idea, what we are following, the wrong idea of what we are following presently is this. If you ask me which treatment can be effective in a specific condition, and sitting here, I become an expert, and then I say that like this is the best treatment, and you follow it. That is the worst idea which can be followed. Expert opinion that has got the least evidence. Least level. That is the least level of evidence. Expert opinion. So research is the best way, easiest way.
So Dr. Amit Trivedi is asking that if we do research related to prevalence of birth defects in government hospital, in how much time we should do it again, and which type of research?
We should do it again in the sense like it has been done already. Okay, even if it has been done already, you can decide as a researcher like a different span of time. Say every 5 years you want to take a data, because when you talk about the prevalence of birth defect, it is more or like collecting a secondary data from the research setup, which is mentioned over here, the government hospital. So probably you can go for every 5 years or every 3 years, every 2 years, based on your background understanding. Like birth defects are very commonly happening, very frequently happening. So probably you can go for every 2 years. Or if it is not that commonly happening, you can go for every 5 years. You can do that. Probably if it is a government setup, they'll be having a protocol of conducting this research in a specific span of time. So if you find out, like, you can be a part of that research collaboration again. And the type of research would be probably a cross-sectional study, what they might be doing.
Yeah. Sir, Dr. Dhruvi Dalwadi is asking that is there any course on research that explains every aspect of the research?
Thank you, Dhruvi. That is a good question. I know during this lockdown period, every one of us are carrying at least 20 to 25 e-certificates with us, doing all sort of webinars. And most of those will be based on either COVID-19 based webinar certificates or any other physiotherapy treatment technique based certificates. We have lots of online courses available for research, which is absolutely free. Lots of courses are available, but most of the courses might not be up to your level. Basically, some courses are, it is not the way what I am talking. It is not that like. It is completely organized in a systematic way, and some courses are for peer reviewing, say for example, some courses are for research collaboration. So probably you should be choosy enough to fit into any of these courses. I'm not aware of any basic courses running presently related to research, but I appreciate that question. Somebody is interested in online course on research. That's a good thing.
Sir, Asta Bodade is asking that in review of literature, how many years back articles can we refer?
It depends on what you are referring to. If you are referring to a new technique, probably if you date back to, say, for example, before 5 years, you might not be having much of articles over there. So there's no point in going beyond that. So probably you can start with, depending on what you're searching, you can start with minimum 5 years. Past 5 years, the research. If you don't get much of articles in the past 5 years, then you can probably go for beyond that. There is no a rule of thumb, fixed rule, sort of like you have to choose only the past 5 years article or only past 1 year article. You can go back, you can start with 2 years, and then if you're not getting much of literature, you can probably go back for 5 years and then 10 years.
Sir, we'll take the last question. Dhruvi Soni is asking that, sir, if on topic has 2 different research results, so what perspective we should look for?
So my understanding of this question is, if one topic has got 2 different, I think she might have missed the E over there.
Yes.
So 2 research has been done on a single topic, and both results are different. That is what I am understanding from this question. Again, critical appraisal is what is going to help you. Out of these 2 similar researches, which one has been done in a proper way, in a systematic way, and based on that, the genuine one, what result it has provided, again, that is that up to the mark. Based on that, you can decide. Again, critical appraisal is the answer.
Fantastic, sir. Sir, it's almost 1 hour and 30 minutes, and you are constantly giving wonderful inputs about the research and all, and we have learned a lot, sir, about the research methodology. Sir, it is fantastic. We really enjoyed the session.
Thank you so much, sir. It was my pleasure being in this platform, interacting with so many people. I'm so happy that there are lots of questions.
Yes, sir. Wonderful. Friends, I will remind you about the masterclass that is for 2 weeks. Total 6 webinars are there, 1.5 hours each, and that will be conducted by Dr. Sarvanan, sir. In this masterclass, you can learn thoroughly about how the research is to be done and how you can publish the research in detail. Sir.
Yes, sir.
Sir, your message for all the viewers, sir.
Thank you, ladies and gentlemen, for being here patiently on a time which is very odd. It's close to dinner time, if I'm right, or post dinner you might be attending this. So thanks to all of you for patient listening. And my wish, our wish basically would be like, try to implement whatever you have learned here. At least 10% population who were present. If you start implementing this, definitely the collaboration, what we are planning for or what we are dreaming of will definitely become a reality. So before winding up, I would say upliftment of the profession is not going to happen by itself. It is not possible by one or two people or one association or one council from a specific place to uplift their profession. It is in our hands. We have to come together in on a common platform to do that. Like so, let us do it professionally. And before winding up, once again, thanks to Niraj sir and all the viewers. Do subscribe to Spinex in conversation with Dr. Niraj Bansali to keep continuing your learning process.
Thank you very much, sir. Thanks a lot. So kind of you, sir.
Thank you.
Friends,
Thank you, and good night, all.
Yeah. Thank you all the viewers for being with us. And sir, I would like to replay your introductory video. So, yeah, and then we end the session, sir.
Thank you, sir.
An eminent personality among the physiotherapy fraternity, Dr. Sarvanan sir. He is the associate professor and in physiotherapy from TN Dr. MGR Medical University, Masters in Sports Physiotherapy from Guru Nanak Dev University, and PhD from Sardar Patel University. He has a vast experience of more than 18 years in the academic field. He has got many achievements throughout his career. He is the resource person for many workshops, which includes taping and research methods in physiotherapy. He has various publications in peer-reviewed and indexed national as well as international journals of repute. He has participated and presented research papers in various international as well as national conferences. He is the editorial board member and reviewer in various international journals of repute. He was the scientific committee member and peer reviewer for the European Region WCPT Congress 2016, Asia Western Pacific Region WCPT Congress 2017, and Physiotherapy UK 2017. He is also certified in the SPSS course. He is a recognized postgraduate teacher and PhD guide in physiotherapy at South Gujarat University. He is also the chairman Board of Studies Physiotherapy at VNSG. He is an elected member in Board of Sports and Students Welfare from Faculty of Medicine VNSG. He is the member of Institutional Ethics Committee at many colleges. He is the recipient of the prestigious C.P. Nair Oration Award at the 57th Annual Conference of Indian Association of Physiotherapists. He is the chairperson West Zone IAP Branch Coordination Committee. He has attended various seminars, CMEs, and workshops on various topics. He has also delivered keynote addresses at various state level and national level conferences.